Well, a very warm welcome from us at the University of Edinburgh, and we're delighted to see so many of you with interest in our MSc Data Science for Health and Social Care. We're looking forward to sharing with you all of our online learning postgraduate opportunities, because we do teach the master's programme, but we also teach individual courses, which is the postgraduate professional development courses. And I know I can recognise a few names on here that have inquired about those in the past. So my name is Michelle Evans, and I'm the Programme Director for the MSc, and I'm joined today by colleagues from the programme. Brittany Blankenship is here, one of our data science lecturers. Would you like to say a quick hello, Brittany?
Hi, everyone. Yes, as Michelle mentioned, I'm a lecturer in data science. It's lovely to see you all here. And yeah, we're happy to answer any questions.
Great, thanks, Brittany. And Kevin is also one of the core teaching team on the MSc. Kevin, would you like to say hello?
Hello, I'm Kevin, and I'm also teaching on the technical side and teaching data science to our students.
Great, thanks, Kevin. And I can't see whether there are any other people directly related to our programme here. We have got a few administrators online, which are core to the delivery of our teaching. They're pivotal to supporting you as students. And also, most importantly, we've got Costa Wesley joining us. Hi, Costa, who's our student rep, one of our student reps actually on the MSc. And I thought it would be really nice for you to meet him today and ask any questions from somebody who's actually on the programme. So hi, Costa.
Hello, hi guys, how are you?
Hi, we're good. It's really nice to see you. Thanks for joining.
Happy to be here, thank you.
Great. So we won't spend too much time. I do talk a lot, so I'm going to try and keep it minimal today to allow time for Costa to give his experience as a student, and most importantly, to allow you time to ask us any questions around the programme. So our programme basically sits in the deanery. It's a very long-winded name, but it's Molecular, Genetic and Population Health Sciences, and we're based at the Usher Institute. So as I said, I'm one of the programme directors, and we're just really keen to get to know you online today. So as I'm talking now in the general intro, just to make sure that you can all hear and you're all settled, if you could pop into the chat just where you're from in the world and why you're interested in studying this programme, that would be really insightful for us to get to know you. So we've done our audio check actually, because you can all hear us fine, so we don't need to go into that detail. And just for those who are unfamiliar with Teams, you can just pop your question in the chat. But as I said, if you would like your mic enabled and you'd like to have a chat rather than type your question, please pop it in the chat area and I can enable it for you. The session will be recorded, and it's actually started already by one of our external administrators from the university. So just to let you know that the recording is in session and will be kept on our university platform to share with a wider audience who couldn't make the session. So I hope you're all okay with that. Okay, so today's session will cover meeting us as a teaching team, getting to know us, the programme structure, how we teach, why you should study with us, why pick our programme, and also how you'll learn. You'll get to meet Costa and have a chat to him from a direct student experience, and also more details from the administration side, which is, you know, how to apply, the supporting evidence you'll need to meet the entry requirements, and also fees and scholarship opportunities. If there's anything that we don't cover that you have a burning desire to ask throughout the session, then please let us know and we can cover that for you, hopefully. So I've already introduced some of our direct team, but there is a much wider teaching team associated with this programme. We've got myself as the director, and also Dr. Nazir Lone, who's our clinical lead. And we've also got other members of the team, people like Dr. Kasia Banas, who covers the undergraduate and postgraduate, so a huge amount of experience teaching in data science. And then you've already met Brittany. And we've also got more, so I couldn't fit them all on one slide, so I just put them into three. Sophie is our statistics lecturer. We've got Kevin, who you've said hello to, which is our teaching fellow. And we've also got very specific expertise in social care and social services, which comes from Kerry Cannon, who is also enhancing our teaching and making sure that we've got the data science and health and social care perspectives and context really forming the foundation for a lot of our courses. Sharon Levi leads our CPD portfolio, so our short courses and postgraduate professional development. And we've also got Yao Sun, our teaching assistant, and Natalia, one of our lecturers, who covers a lot of our programs. Most importantly is our professional services team. They are really the backbone of the program, and also your support, direct support to you. We've got Laura Miller, who's our program administrator, and we've also got roles like student advisors and student wellbeing roles, which are really key to supporting you in your learning journey with us at the university. It's also good to note that we also draw from a really wide pool of experts from public, private and third sector and industry. And that really keeps our content up to date and relevant to industry, aligning with competencies and knowledge that is needed in the area, and also bringing skills and knowledge and expertise in their own domain areas through design and shaping the courses to make sure they're relevant, current, and most importantly, applied to practice. So we are one programme in our Usher Institute, the Deanery, and there's just a list here, and I noticed that some of you are registered for more than one programme, and rightly so. You should have scoped them all out. But the MSc Clinical Trials is one of our programmes, epidemiology, family med. We've got 2 public health programmes on campus and online. And we've also got, as I said, lots of postgraduate professional development opportunities as well at the university. So why should you study with us? I mean, some of these are obvious for outward people looking into our university. They're drawn by the kind of world-leading research and teaching at the university. And also for statistics like, being one of the top 10 institutions for employability, which I didn't actually realise until the other day. So that's really great for us. And also the most international university, being ranked at 18th in the tables for that. So we do draw a lot of students, not only from locally, if we're developing master's programs, all of our students are from global audiences. So I thought I'd just share this beautiful picture because it just makes me happy. And also it's just nice to be back on campus due to being off campus for a while. And this really does just demonstrate, all of our kind of history across the university and bringing old and new together. And I know that you won't be on campus specifically, but there will be kind of opportunities to visit us on campus, especially when you graduate, which is the most exciting part of the learning journey with us. So some of the main reasons that I've picked out why our programme is attractive for potential students is obviously it's highly flexible. So there's lots of ways that you can engage with our programme and also tailor your own learning pathway because of the breadth of elective courses that we offer you as students. We do have a proven track record as well of data-driven innovation at the Usher Institute. The Usher Institute specialises in working with people, populations and their data. And that is really to understand and advance the health of individuals and populations. And it's through these innovative collaborations that we are making through the development of this programme that creates that global community that you would be part of. And you'll be joining that as a student and hopefully benefiting and gaining from that. It also offers access to real world data, which you'll come across in your research project in your third year. And it's a really vibrant, driven data community, and you will experience that. And I'm hoping Costa will share his experiences on that as well. From a support system, our support network draws from all the people that I just showed you. That's why I've put this so early in the presentation. So you will gain from the academic leadership, from the teaching team, but most importantly from the teaching teams themselves and from student advice and student wellbeing support. And also from your own peer-to-peer learning, which is the most important part of your journey. And one of the most one of the biggest pieces of feedback we get from students is gaining from each other and learning from each other. So I just popped this on just to ensure that you are at the right session as well, to wake people up. This is an MSc for Data Science for Health and Social Care. And I just to point out that we are drawing all of this data science expertise in the health and social care context. And I think that's what's most valuable to a lot of our kind of computational backgrounds, for example. They want to gain that health and social care context, or from the health and social care sector. We're drawing on all of these aspects which create, you know, the domain expertise in this area. And all of our courses are based around, you know, why data is important for health and social care. I've drawn a few things here from last year's session because I just ask the question normally, you know, why you think data is important for health and social care. And some people were saying that, you know, it's vital for managing individuals' care, to improve diagnosis, developing new services, and also evaluating the effectiveness of policy, for example, or for service budget decisions, for example. But most importantly, innovation with data is really key in response to public health challenges. And I think that's where our focus is, in enabling you to achieve that. So it really helps drive further improvements in population health, and especially across health systems management, from tackling, you know, challenges of increasing number of people living with long-term conditions. And hopefully you'll be part of gaining those skills and knowledge to create an impact in this area. Would anybody from the teaching team like to expand on why they think data science is important in health and social care from your perspectives, from the teaching side?
Sure, I can jump in if that's okay.
Yeah, go for it,
Yeah.
Brittany.
So from the teaching side, I think it's so important because we've just come out of a pandemic. We've all experienced that. Arguably could still be considered in the pandemic. But when we're dealing with health and social care, this is not just something that's unique to the local area that we're working, but also using data to impact how we live our lives and how we live our lives well and in a safe environment is something that's so important, not only presently, but in the future. And I think that it's really at the cutting edge, the skill sets that we provide our students and the things that we're teaching, and the diversity of backgrounds our students have and their different perspectives all coming together. So Michelle mentioned part of the really wonderful learning environment that we have is this peer-to-peer learning. And I think that I can say from a teaching perspective, I learned so much from the students every day as well. So I think that's a really unique and cool opportunity that this master's in particular offers, is learning not only from the teaching team, but also from your peers and colleagues as well.
Thanks, Brittany. That's great insight. Anybody else? Kevin, as a new teaching fellow, putting you on the spot.
Yeah, I just like to jump in there. Yeah, just to echo what Brittany has already said. one of the most amazing things that I found being on this program was that the students that we get are domain experts in themselves, and also they bring their own expertise and their own context into the problem that we're solving. So sometimes we'll be giving you tools, for example, a data analysis skill or a graphing skill, and then you apply it into your own practice, and you can see how they can already apply it straight into the practice, and you can see having impact into their own work already, straight from the start of the program all the way to the end. So that's been a very insightful journey to see the students grow from our perspective.
That's great. Thanks, Kevin. So I'll just move on. Unfortunately, the formatting has gone funny with my presentation, bringing it from Canva, but you can find these online anyway. These are our learning outcomes for the programme, and they just demonstrate really the areas that we're concentrating on as we teach across the programme. So I won't spend too much time on this because you can find these yourself. I'll pop in the website in the chat so that you've got that, but I think you will you'll all know where to find those, but I'll share that anyway, just in case. Just to summarize our program first of all, and then I'll go into the program structure and the actual how you'll learn. But we offer an MSc in data science, health and social care, but we also offer a diploma and a certificate. And also the postgraduate professional development suite of courses you can take as standalone courses. This program is 100% online. There's no requirement to be in Edinburgh, although we welcome you. I've had many visitors in the past that have been studying with us who've come or happen to be in Edinburgh, and we'd always welcome you on campus and give you a tour if you are ever in Edinburgh itself. The minimum kind of hours, these are just the most common questions people ask me usually. The minimum amount of hours that we would want you to apply is between 10 and 12 hours of learning per week, but this does really vary a lot depending on your experience, your expertise, and how much you want to apply, obviously, to your development. It is primarily designed for busy health and social care professionals at different career stages with varying exposures to data science. So as I said, the most common kind of question I get when I do one-to-ones with potential candidates is, how will this benefit me in my own health and in my own context or area of expertise? And I think the biggest thing is what Kevin and Brittany alluded to there, this peer-to-peer learning and being open to new ways of using data in different contexts as well to improve health outcomes overall is our ultimate aim. So online degrees are equal to on-campus degrees. This is another question I get asked a lot via the Dynamics queries that we receive through the university. Does it carry and merit the same weight as an on-campus degree? And yes, it does. And actually, people tend to underestimate how many hours it does take to engage with online learning because they think it's a quick and easy way to gain a certification. But actually, it's the same amount of learning and the same amount of commitment that you'll be doing online as on campus. So this is a bit of a busy slide, but it just tries to summarize the experience for you as you come in through year 1, year 2, and year 3. And again, apologies for the formatting on this, but I can just explain it. So in year 1, you would come in as a student in September. Usually there's an induction or pre-reading or kind of information around the programme. And then in blocks 1 and 2, which is from September to December, you would study Introduction to Data Science for Health and Social Care. And that's a compulsory course for all students in year 1. And then to build your own learning pathway, depending on your particular background, then there's a suite of electives that you can choose from. And actually, I wonder if one of the team could pop our degree program timetable on there so that they can see the the options for all of our electives. But there's things like data analysis with R, data visualization, and knowledge transfer, things like systems thinking, Python, introduction to Python, working with Python and R is one of our courses as well. So there's a huge amount to choose from, and you can. The aim behind that is to hopefully meet the need of all of our professional backgrounds that come in to study with us. In year 2, the compulsory aspect is the research design element, which is really forming a foundation of knowledge that you would require to progress into the dissertation year. So that is another 20 credit compulsory course. And again, you've got the choice of choosing from a suite of electives to shape the rest of year 2. The final year is year 3, and that's the dissertation year. And there are many options that you can complete in the dissertation year. There's the standard traditional dissertation, where which most of you probably are all familiar with. But there are also other options. For example, industry placements. I'm working with industry for your 3rd year on a particular project or challenge. And then also there's a student-led individually created course. So you can design your own learning outcomes to benefit your needs for your professional development in year 3. We've done this because we recognise that not all students want to go down the pure research route, but they still want to advance in their skills in the domain of research design and applying that in a particular project that they want to pursue. As I've said, some of these courses are standalone. Most of them actually are standalone postgraduate professional development courses, but please be aware that some do need, and most do actually need prerequisites. So making sure that you can carry out those courses if you do choose to go down the PPD route. So do check the degree programme timetable for those. Okay, so how will you learn? And usually we do a demo of the Learn Ultra, but since we've updated our presentations, we now have a video where you can see how you'll learn in Learn Ultra Blackboard, which is the virtual learning platform we use at the University of Edinburgh. So I can also share that with you in either now or through email, because we do have your contact details, so I can follow up with how you'll learn. For just out of interest, for those online joining us, who has actually used online platforms for learning, whether it be Moodle or Learn or Canva? Just a yes or no on what platform? That would be handy to know. Okay, so Michael's, yeah, Johnny's used learning platforms. Moodle is one of my favorites, actually. I do like Moodle. So yeah, so most of you, I think, will probably have engaged with some form of online learning, and it's not unlike Moodle. It's the same kind of approach to the design of the learning content. But as I said, I'll share that with you so you can have a look. So from a learning and assessment perspective, we've just listed some really basic approaches, because this is another common question that we get asked. You know, are there any exams? Are there any kind of compulsory elements to completing the programme? And obviously the compulsory elements come with the compulsory of completing the course. So there's no pre-exam or entry to access the MSc, because that's a common question, and I'm not sure whether other masters do that, and that's why it stemmed that question, but we don't. So all of our learning assessment are attached to each course, whether it be a 10 credit course or a 20 credit course. 10 credit courses run over 5 weeks and 20 credit courses run over 10. We really are trying to be as flexible and as offering as much variety as we can to meet the competencies of the program in setting the learning and assessment for you. So there's traditional ways where we do group projects or group work activities. And there's also things like peer assisted learning and practical tutorials. All of our tutorials are recorded. So if you do miss a live tutorial, then you can come back and review it in your own time. And also there's a huge self-directed learning element, obviously, because we expect you to ensure that you're keeping engaged with the content. But these are all enhanced really by our assessment and learning how we set those in each of the courses. So to bring out your presentation skills, we'll have, set assessment in line with needing to provide us with a presentation based on a specific area, and also your critical appraisal skills and your reflective practice and all the elements that we want you to be able to come away with from the programme are teased out in the elements of the learning and assessment that we set. Okay, so one element is which is really strong on the programme is student voice, and this is where I'm going to ask Costa to come in and give his take from a student perspective. But the student voice is really embedded across the whole programme, from the staff student liaison committee that we set up, where the student rep, such as people like Costa, come into the programme and set the agenda for us as the academic teaching team, and making sure that things are clear to students, that the academic content is robust and meeting the needs of our current students. So that dialogue between us and students is very open, and you're part of this as much as we are trying to improve your learning experience. So we really do value your opinions as you progress with us through the programme. We have student representatives across all cohorts. And we also have deanery student representatives, so you will get the opportunity to be the voice of our deanery student community. And then we also collect feedback through normal means of surveys, course feedback, real-time feedback in discussion boards, and academic cohort support from the teaching team. So I'm going to ask Costa if he could come in and just give his background and experience and open up to any questions, if that's okay, Costa.
Yeah, that's perfect.
Thank you.
So I've prepared a presentation, so if you don't mind, I can just upload it quickly, then we get going.
Yeah, of course.
All right, thank you.
There you go, I've stopped presenting for you. Perfect. Can see that.
Right.
It's a lovely
Thanks.
front cover.
Thank you. Hello, everyone, the teaching staff, and of course, prospective students who've just joined us on today's session. My name is Costa Wesele. I'm originally from Zimbabwe, but currently I'm based in South Africa. Just as many of you, I was in the same position that you might be in this moment last year, around the same time, with all the questions, the concerns and the anxiety, and of course, the desire to want to learn something. So I'm a first year student, and I'm also serving as a student rep. That's awesome. A a brief of my background is, I'm from Zimbabwe, and of course, I've got an honors in psychology. And before joining this course, I had no prior computational or coding background. For some of those who will be anxious about not having the computational and the coding experience, I know it can be really anxious, wanting to, diving deep into something that you're not very familiar with. Before I really joined the program, I bumped across an online, and it was an article from Harvard Business Review from 2012, which said that apparently data science, data scientist, could be the sexiest job of the 21st century. So that was my first encounter with with the world of data science. So that's where the enthusiasm and the intention to know more came about. And then I had to dig deep and did a bit of research before I did enroll for the program. And after doing a bit of research, I had to make a choice. And of course, given the experience and the research, I had some information. And most importantly, I did realize that data science would give me an opportunity to change careers, because from psychology, I didn't feel the energy and the enthusiasm to carry on. I wanted something different, and I felt data science would give me that edge. And also, looking at the statistics, whatever publication you can browse through, data science is one of those skills that is one of the most sought worldwide. It's more like a passport to the world. If wherever you want to go, or the easiest way to immigrate for employment purposes, they require you to have critical skills, and data science is one of those which are at the very top. And with it as a qualification and as a course, it gives you the flexibility to channel a career, in whatever direction you so wish, because there are so many options. Data science is broad. There are so many options for everybody who so seek, to channel their careers in whatever ways they might so wish. And for somebody like me, who's more oftentimes, caught in the crossroads, not knowing which direction to take, I think data science gives you that opportunity where, with the skills and all the stuff that you learn, you get all the options at your disposal to be able to to wander around and eventually be able to to have a choice at the end of the day. So it's very flexible. It's broad. And the program structure, from my understanding as a student, I did really find it to be very practical. Given that the majority of the students, they come from across the world, and it gives you an opportunity to learn. And let's say, for example, you miss a lecture, you can catch another lecture, or you can go to the to learn pages and get access to the recorded materials. So it's very practical, so that it can meet the needs of different people from different geographical locations. And also the course, the material is very relevant. As soon as you do attend lectures and get to engage with the learning material, you start to get, I would say, the information that you get, they've got instant applications. That's what I want to say. They've got instant applications. The way you relate to data before studying data science and after having interacted with this is totally different. So it's an instant applicable course. And also, one thing that I really loved is the opportunity to choose the courses that I would want. They are elective courses. Of course, they are compulsory courses, but the opportunity to tailor my learning according to my desires is something that is really, really attractive about this course. And also, the opportunity to interact and to have guest lectures from leading industry experts, from health and social care, and from all the relevant fields. It's really insightful because it gives you it merges theory and practice. People who have walked through this journey and who have had hands-on experience, they just brings this complete picture. They just complete the puzzle from classroom learning to experience. So that's why it's something that I really love. So as far as a program structure, from my experience as a student, this is all I can say. And also in terms of the learning experience, it's really, really awesome. Having been a student before from other universities and coming here, I really found it to be very impressive that the amount of support that we get from the teaching staff, from the support staff, and from all the relevant people in the university is very, very impressive. They make you feel at home. From the word go, you feel like you have known these people for a long time. So it's something that I really love, and that goes with the fact that also the kind of workloads in terms of the material, the exercises that you have to do, the reading materials, and all that kind of stuff. It's really manageable. So if you are a professional, working as most of you will be, this course won't suffocate you. The material is designed for working professionals. So you'll be able to live your normal life, study, and work at the same time. So that's something that I really found to be really interesting and fascinating and impressive, of course. And also, as I've said before on my first slide, that when I came to the course, I had no prior coding experience. But I can safely say, just a few months down the line, I've acquired important, fundamentals in terms of computer programming and all those areas of anxiety that I had. So I can say, I can do that, beyond being able to code and program, I can also communicate and collaborate, which are some of the soft skills that you gain from this course. So other than, the hands-on technical skills, you are also bound to get to learn soft skills, which are very important, that will make you, I would say, a complete package, as a professional going into the world. And also the opportunity to learn in a group environment with the people from different parts of the world, with the different skills and cultures. I think just the whole icing on the cake, because it gives you a 360 view of the health and social care. For example, I'm from Zimbabwe. The health and social care system is totally different from the UK and from South Africa and from other parts of the world. So having the opportunity to absorb all those different perspectives and traditions and the way things are done is really fascinating, and one of the things that makes this course really fascinating. I think that's the end of my presentation, and I'll take questions from the floor. Thank you.
Oh, I think you're muted, Michelle.
Sorry, thanks.
Yeah, there you go.
Thanks, Brittany. Just to say thank you so much for summarising that. It's just really nice to hear it from our perspective for the teaching team as well. And I think you just did such a great job of summarising your whole experience. So thanks very much. I'm